Bristol Health Partners has a really unique way of bringing together health and care professionals, public contributors and people with lived experience, and academics in order to find out more about conditions and also evaluate services and better understand need to produce information that health and care commissioners and practitioners can use in their day-to-day practice.
So a health integration team is a bringing together of people with a passion and energy to make a change in a specific area. The most valuable thing about being part of a health integration team is about being able to work in a completely different way to how we worked before, working with our partner organisations and working really closely with patients and the public to make sure that what we do is what we should be doing and that it makes a difference.
It's really important that patients themselves and people connected with patients have an opportunity to voice their needs. When you're sitting at home and you hear things on the news about changes that are being made, particularly to health services, the only way that you're going to have an influence on those changes is to become involved in something like Bristol Health Partners, because they are the ones that are talking to the people that are making the decisions. So if you can go in as a public or a patient rep, then you have a really good opportunity to make your voice heard.
People need to engage with Bristol Health Partners because they're a really good source of information in order to make decisions. So they can bring together research findings, better understanding about what health needs are, better understanding of the way our services are or aren't effective, and all of that's really important information that decision makers need in order to make good decisions.
Bristol Health Partners, as a now accredited academic health science centre, has the ability to draw together the right connections, draw together clinical services and researchers, but also to lead with the values and principles of inclusion and reducing health inequalities to try to make some practical differences on those fronts.
The way that health and care is being structured at the moment is really different, and I think that's where we can really use the input of people looking at the research, the public contribution, the evaluations to help really shape that and to further boost the collaboration that's already started in our area.